everybody. Hello, and welcome to Previous Shortcuts. Welcome to another session with updates for you today. Welcome, everyone. Please type a hello, type hi, type yes, write something in the comments. Let me make sure that you can hear me and that you can see me as well. How's everyone doing tonight? Great to have all of you on tonight. Tonight, we're going to focus on Chapter 5. I'm going to cover some of the most important updates when it comes to the infections chapter. One of the reasons why this is so important is because of the pharmacy first service. So as you guys all know, as pharmacists, we will soon be prescribing or be expected to prescribe a lot more antibiotics than ever before. And one of those antibiotics is uncomplicated urinary tract infections in women. So this is so important. So this session is not just for trainee pharmacists, also for pharmacists, for pharmacy students, for anyone that is going to be prescribing, anyone that's interested in learning about the recent updates, the BNF updates, NICE guidelines when it comes to the infections chapter, then you are in the right place. Let me start off by giving a special shout out to all of you. Thank you, Rosanna, for joining us today. Thank you, Blue Melon. Great to have you on. Ramu, Alexandra, great to have you. Great to have all of you on today. So as usual, this session is going to start from now all the way till 8 o'clock, and then I will continue from 8 o'clock with those of you on the combo course. We've got a class this evening specifically focusing on infections, so we will cover quite a lot tonight. But for all of you here on YouTube, let's see what we have for you today. Very interesting. So I'm going to ask you guys a few questions. What if you had to give yourself a rating between 1 to 10? Where would you put yourself at this current point in time when it comes to infections? How confident are you? If you had to give yourself between 1 and 10, how confident are you with infections, with prescribing, with knowing your common infections, what antibiotics are used to treat different infections, counseling, patient advice? How do you feel? The reason why I'm asking is because by this time, well, in January, by the end of January, there is going to be the introduction of the pharmacy first service. We all know that the service requires us to renew our knowledge, to refresh our knowledge, because if you're like me, I've been practicing for a long time, you tend to forget some of this stuff unless you use it. It's like a muscle. If you don't use the muscle, you're going to lose it. It's the same thing with knowledge. If you're going to be a prescriber and you're not used to refreshing that knowledge, knowing about your conditions, your antibiotic conditions, then there's a very high chance that you will lose the knowledge. And that's the reason why I'm here tonight, is to refresh that knowledge so that you are a professional, you're a good professional healthcare provider, and you can provide a fantastic service. Great stuff. Because I've been reading your materials, it's very good. Great to know. Thank you so much for the feedback. I appreciate that, Ramu. Ramu, I appreciate it. Thank you very much. Okay, here's what I have for you guys. I'm going to make it short and simple, but very practical. So here's what we're going to cover. This session, I'm going to look at infections updates. So make sure you have your BNF 86. That's the most up-to-date BNF. But I always recommend the online BNF, because even though this is up-to-date, it is still not up-to-date because there are regular updates. So the online BNF is probably your most up-to-date, most reliable source of information, as well as your NICE guidelines. And that's practically what I use for most of these sessions and throughout all my training on the course. So guys, I'm so excited as always. I get so excited when I'm teaching. I get so excited when I'm about to give you something of value that will make a difference, not only to your life, but to all the patients that you come in contact with. So here's what we're going to do today. Let's look at the good thing about it is in this BNF edition, there are not so too many updates when it comes to infections, which is quite good. But there are some key ones that you absolutely need to learn. And one of the reasons why you need to learn this is because we constantly get all these MHRA updates about these specific drugs, about these specific areas. And there's a very high chance that with the introduction of the pharmacy first service, most of us are all going to be tested on our knowledge when it comes to urinary tract infections. And today we're going to be looking at one of the updates that relates to a urinary tract infection drug. So perfect timing. We're going to look at quinolones very quickly. There is a new update with quinolones. Can you guys put some examples of quinolones and just make sure I'm in the right place? Anyone know an example of a quinolone? Pharmacists, pharmacy students, pharmacy trainees. Just type in the comments. Give me an example. Give me an example of a quinolone. Cipro, thank you, Ramos. Ciprofloxacin. So all your floxacins are ciprofloxacins. These are levofloxacins. These are your quinolones. Ofloxacin, thank you, Marco. Adoni, great. Krishna, limitless. There's no limit to Krishna. I love it. Krishna, great stuff, Cipro. So with these drugs, the reason why it's so important is because there has been an update recently. It's not a new update as such, but it's one that has been re-emphasized because it's that important. All right. So suicidal thoughts and behavior. How many of you dispense these drugs in the pharmacy? Ciprofloxacin. How many of you dispense this, or how many of you probably maybe taking this or have someone that's taking this medication in the family, or has anyone that's ever taken any of these medications, any quinolones? Now with quinolones, we've always spoken about tendon damage, and if you have any problems, your tendons, tendonitis. But an area that isn't spoken a lot about, which is one of the updates that you need to be very focused on, is suicidal thoughts and behavior. So we always knew that, yes, these drugs do cause some mental challenges, but it's so important now that when you dispense this medication to any patients, you do keep an eye on them, especially for the first few days when they start taking the medications, just in case they have any sort of suicidal thoughts or any sort of suicidal behavior. It has irreversible side effects, and the research shows that these side effects not only affect one part of the body. So it's not just the brain, it's your whole body, your musculoskeletal system, right? Your cardio system, all over your body, literally your entire body, all your systems could be affected by quinolones. So it's so important that you learn all the updates when it comes to this group of drugs. And that's what we're going to do today. And then the second one, which is probably to me at this point in time, the most important, is nitrofurantoin. And I said the reason why earlier, it's simply because of pharmacy first. We will be dispensing this medication more in pharmacies. We will be giving more counseling on this medication. So it's definitely one that if you have to update your knowledge, make sure that you are good when it comes to UTIs. So there's also an update, a reminder of the risk of pulmonary and hepatic adverse drug effects. So as I mentioned before, some of these MHRA updates are not really new. They're just reminders. And sometimes this happens when there's been an incident, right? There has been some sort of fatality, and then this becomes even more serious. And then a message goes out there for all healthcare professionals to be very vigilant with this specific aspect of the medication. We've got erythromycin, nothing much on this. I went through this last time to do with early syphilis, but I will focus on the top two because I think these are the most important for you that you need to apply straight away. And then you also have some malaria updates, which I'm going to cover on later on in the course. So if you're ready to get all the updates, if you're ready to be tested to see how good your knowledge is, please type a 1 in the comment section. I always have interactive sessions. I'm always interactive because I think you learn best by interaction. So I'm going to ask you guys questions, and please give me your answers. These are questions that you will face on a day-to-day basis at work, as a pharmacist, as a healthcare professional. So there is no escaping these questions. Right, so let's look at quinolones. Right, you guys have given me some examples. Well done. This is what is so important. And for this reason, I'm slowing down. Many healthcare professionals, many pharmacists, including myself, we dispense this medication, but not everyone thinks or is aware of the interaction between these antibiotics and NSAIDs. So we need to be very careful with drugs that we sell over the counter, P-meds, OTC meds, those that interact with prescription-only medications. It is so vital that we learn this because these are the ones that have a higher risk of having near misses and accidents and literally causing the worst situations in our pharmacy. For example, miconazole and warfarin, that led to the death of a patient. So these medications that interact over the counter, your normal medications that your counter assistants are selling, you need to be very careful. As long as they go through those warm questions and they make sure that there's no interaction, then you're safe. But this is our role as pharmacists, as healthcare professionals, to ensure the safety of our patients. So NSAIDs, let's look at the first one. What are some of the important interactions with NSAIDs? Can you give ciprofloxacin with ibuprofen? Patient walks into your pharmacy. The patient has come to buy some ibuprofen. The patient's got a little bit of a headache. For some reason, they want ibuprofen. Will you sell that medication? The patient also has ciprofloxacin prescription. So a big one is convulsions. And what's so interesting about this is that an NSAID, a combination with your NSAID and a quinolone, for example, ciprofloxacin, if you combine these two together, it increases your chance of you getting a seizure. They increase the chance of you having a seizure. Now, this is even the most interesting part. It doesn't matter even if you're epileptic or not. That means if you've never had a seizure before, you're not epileptic, you could actually have a seizure if your doctor prescribed you Cipro and you took some ibuprofen with this medication. So you could see how important this is. So definitely that's a big one. NSAIDs in the pharmacy. Please take notes with these antibiotics. Great stuff. So good answers. So we've got examples which you guys put down. We've got avoid in MRSA. These are from our combo course notes, by the way. So some of you may see certain blue areas that say GPHC exam question. So if you're a pharmacist, don't worry about this. If you are a trainee, this simply means you could potentially get tested in your exam on these areas. So we've spoken about convulsions. So what NSAIDs effectively do is they could reduce that seizure threshold. So they increase your risk of having a seizure, whether you're epileptic or not. So you have to be very vigilant with this. Another area is tendon damage. All right, so inflammation, rupture. If a patient is over 60, then they have a higher risk of tendon damage, have probably a higher risk of bone issues. So in that case, you have to be very careful with the over 60s and anyone taking steroids as well, corticosteroids. So if they have any sort of tendon damage, pain in the muscle, then you need to start looking at stopping this medication. So those are the main ones you have to look out for, right? So look out for the mental side of things, suicidal thoughts. Look out for interactions with your NSAIDs, such as ibuprofen. Look out for any tendon pain, any tendon damage, and then be very vigilant with any sort of epileptic patients because it can increase the risk of them having a seizure. Exposure to sunlight, excessive sunlight. Most of us ignore this because we hardly get any sunlight at all in the UK. So we just cross it off because you don't give anyone any advice, do you, when it comes to sunlight? But then remember, people do go on holidays, so you want to obviously advise them about avoiding excessive sunlight. Another important one is QT interval prolongation. So again, quinolones could cause an arrhythmia. Right? They could lead to an arrhythmia. So anyone that's got any history of arrhythmia, any cardiac problems, you also need to be very vigilant, very careful when you prescribe quinolones to them. So definitely epilepsy, seizures, these are the most important things to learn. We also have children. So these medications also affect growth. So young children, growing children, this is not recommended for them because it could cause a lot of joint diseases. So they could hinder the growth of children. That's why we don't really prescribe, we don't encourage them to prescribe quinolones. Psychiatric, we've mentioned that, neurological issues, big one. Pregnancy, definitely we need to avoid this drug in pregnancy. And I mentioned earlier your important interactions to look out for as pharmacists. I would say the top two are your NSAIDs interactions because you prescribe those all the time, and then prednisolone. If anyone taking a corticosteroid that's prescribed any of these medications, there is a very, very high risk of them getting tendon damage. So if you don't take anything away and you take these 2 points, then you've literally increased your chance of saving a life. You've increased your knowledge and you've increased your likelihood of providing an efficient service to your patients. So that's quinolones. And in terms of the advice that we have to give, I've just put this there for you. A big challenge that we have as healthcare professionals is breaking down language into user-friendly language, breaking down complex scientific language, because most of the time we learn from the BNF, NICE guidelines. We're so used to medical jargon that we don't realize that the public needs simple language. Hence the reason why I always put this down, which is just, I put down the simple patient-friendly language that you want to use when you're counseling your patients. So with these drugs, with your quinolones, you have to make sure, tell them to report any severe side effects to do with the joints, to do with tendons, any sort of mental health, any sort of hallucinations. They need to report this. Any thoughts of suicide, they need to report this. Any swelling in the legs, swelling in the joints, numbness, any tingling sensation, any burning. So these are the words that you have to use if you want to explain this to the public, to your patients, in a very, very user-friendly language. Severe tiredness, depressed mood, patients understand these languages, so they will be able to pick out any of these symptoms if they experience them. So that's it for quinolones. The update was definitely on this, but the main part of your update from the MHRA is to do with suicide tendencies, suicidal thoughts. And that's one thing that you need to emphasize and make sure you check with all patients that are on these medications. Okay, next one, nitrofurantoin. If you are ready for the big one, this is one that you need to learn inside out, and I'm going to have lots of questions for you. If you are ready for nitro, please type a 2. Type a 2 in the comments. Let's learn this medication. Pharmacy first. The service is going to be operational very, very soon. And when this service starts, everyone will expect you to know this stuff. Everyone will expect you to know this. It's your responsibility to keep yourself up to date. Right. So what is it used for? Question number 1. Let's see the different uses that some of us can remember. What is it used for? What is nitrofurantoin used for? So we're going to start with the indication. UTI. Thank you, Ramos. That's the first that comes to mind. UTI. The reason why I'm asking this question is because we all think UTI, but we need to know the different types, right? But yes, absolutely UTI. Hardly used for anything else. So I've got lower, and this is what I'm going to stress. The reason why I was asking you what is this used for is so that you're able to make a distinction between lower urinary tract infections. So lower UTIs, UTIs that are associated with catheters, severe chronic recurrent UTIs, and then UTIs when you have, say, a surgery, right? So genital urinary surgery. So it's so important that at this stage, you don't just learn UTIs and just think, okay, UTIs, that's it. You have different levels. So you've got uncomplicated UTI. So someone's going to ask me, Marvin, why? I thought UTIs were UTIs. This is the reason why I'm stressing on this. What does the pharmacy first cover? What type of UTI? The pharmacy first service. What type of UTI are we going to be able to prescribe for? Is it all UTIs? Is it just UTI in general? Or is there a specific type? Is that what does the specification say, or your PGDs? Very, very important question, guys. Very important. So Marco says lower uncomplicated. Thank you. Uncomplicated UTIs. Thank you, Ramo. I've got lower UTIs. Thank you. Thank you, Hassan. Lower UTIs. Hence the reason why I was asking you the different types of UTIs. We're breaking this down and we're making you more proficient, because you're no longer going to be one of those people that just say, yes, UTI. You'll be able to say the specific type. So it is uncomplicated, lower UTI. So uncomplicated, but in which type of what in who, right? Uncomplicated in what type of patients? Is that specific? Can we do this in children? Are we going to be able to prescribe on the service to men, to women, to children? Uncomplicated urinary tract infection in women. Krishna, well done. Okay, 16 to 65, so in women. And thank you very much, Ramu, non-pregnant. Very important as well. So what we've taken away from this is that this is so important. In the next month, you will be having patients coming in, and you'll be having people being referred to your pharmacy. And these people are going to come in with UTI, and you will have to go through these questions, and you will have to prescribe to them, right, following your PGD. So the first thing you need to know is uncomplicated UTI, and also just women, right? Just women, not men. So let me ask you more questions. So what is the dose for lower urinary tract infections? So imagine that, yes, you've gone through the consultation, and now the patient's got UTI, you've done your test, and it's fine. You need to prescribe the antibiotic. What is the dose for a lower urinary tract infection, uncomplicated? Or what are you going to prescribe? What is the dose? If you don't put the answer down, if you don't put a big 0, please. I love interacting with you. I just want to know where everyone is. It's really, really important. This is a very, I won't say simple, they're essential things for you to learn. And you could take a lot from these sessions. Just in about 5 minutes, you can learn so much that can make a massive difference. So, all right, so I've got 3-7. Yes, so I was going to ask, that'll be my next question. So I'm getting loads of answers. Great stuff. So I'm getting 100. So what we need to realize that you have the modified release and you've got immediate release. So when I ask you what dose, it depends on what you're dispensing. Are you dispensing the immediate release or are you dispensing modified release? So if it's immediate release, you're looking at 50 milligrams 4 times a day. And if it's modified release, it's 100 milligrams twice a day. The next question is what most of you already answered is it was to do with the number of days, but I'll come to that question. So it's important that we know this as well. Is it 3 days? Is it 7 days? Or is it 3 days? Is it 3 days or is it 7 days? Is it 3 days or because I've got 7 days? Some people put 7 days and some have put 3 days. So let's find out what it is. Okay, so is it safe in pregnancy? We know the service doesn't apply to pregnant women, but what if, is it safe in pregnancy? Does anyone have a BNF PDF 86? You're not going to get a BNF PDF 86. You have to buy this. You can order that online. Or I think if you're part of the RPS, then I think you get it for free. I don't know. Don't quote me on that. But I think with the RPS, you may be able to get BNF or is it MEP? I'm not sure. But I got mine online. Right. Let's see. Yes, not a term. Thank you. Only term time. Oh, only term time. All right, so it is safe but not at term, right? That simply means the last weeks of pregnancy don't give this drug. But why? Someone says, yes, I've seen it used before, and that's correct. It can be used, but it can only be used up to a certain level. There's a certain time you cannot use it anymore because then it becomes very dangerous. So that's what we call term. So terms are your last weeks of pregnancy, right? The final weeks of pregnancy. Marco, thank you very much. It's hemolytic risk for the fetus, right? So neonatal hemolysis. So according to your guidelines, it's not known to be harmful. So it's fine in pregnant women, but however, they recommend that nitrofurantoin should be avoided at term. So you could use it the first trimester, second trimester. When you get to the last trimester, towards the end of it, please don't use it because it is a risk, causal risk of bleeding. Great. Good interaction. So how many days treatment? Right. So some of you put 7 days and some of you put 3 days. So what is it for lower, uncomplicated urinary tract infections? The one that we will be doing on our pharmacy first service. The one that you'll be doing in the next few weeks. What is it? Is it 3 days or is it 7 days? AC says learning a lot. Thank you so much for that comment. If you are learning a lot, please type a me in there. If you are learning something, please type a me. Type me. That's great to know. Thanks for the feedback. It means a lot to me. Okay, 3 days. 3 days for uncomplicated. 3 days. Thank you so much. I'm getting a lot of confidence with 3 days. Everybody else is 7-7. Brilliant. Brilliant. So yes, that's a good way to learn it, right? It's 3 days and then everybody else is 7-7. Right, so if you're a lady, 3 days uncomplicated lower urinary tract infection. So the assumption is that most of the prescribing that we will do will just be for 3 days. But what if it's a man? Well, we're not going to do males because our service is only for women. But what if it was a UTI in a man with nitro? How many days is that going to be? What if it's a man? How many days? 7 days. Great. So that's what you have. So this is so important that you learn. It's 3 days for everyone. It's 3 days. So most of what you're going to do is 3 days. But if it's a male, then it's 7 days. And if the lady is pregnant, it is 7 days. Hopefully the male and the pregnant are not part of our PGD for now, but it's worth learning because they may be in the future. So 3 days is probably what we all at least need to learn. Okay. Great answers. Really, really good answers. Okay, let's see this next question. So what do you monitor with nitro? Because you will be dispensing this. You will have to advise the patient. You have to give them some counseling points. What are the key things that you need to monitor with this medication? Or what do you have to advise the patient to look out for? By the way, for everyone that's on our program, on our foundation training, Today, after this session from 8 o'clock, we're going to be focusing on chapter 5, infections. I'm going to go through a lot of GPC style questions, a lot of areas that you get tested, the most common infections. I'll go through so much that's going to help you and build your confidence. Yeah, so lower back pain, pulmonary reactions. So that's a big one. So when we talk about the MHRA warnings or the advice, the big update is a reminder of the effects on your liver and the effects on your lungs. Pulmonary and hepatic. These are the most important updates. These are the recent updates, right? It's a reminder for all healthcare professionals about the importance of hepatic and pulmonary reactions with nitro. Okay, so renal function, they need to monitor renal function, they need to monitor the liver and pulmonary function. But again, we need to go back to that patient-friendly language, don't we? We can't tell them, hey, watch out for your renal function and keep an eye on your hepatic function. We cannot tell them that. Or just be mindful of your pulmonary function. We need to break it down in a user-friendly language. So an important thing is, since it's excreted via kidneys, your renal function is so important. Basically, if a patient has an eGFR of less than 45, then they shouldn't be given nitrofurantoin. So the excretion, for it to be excreted, you need to have a good functioning kidney, and you need to have that filtration has to be 45 mils and above. So that's an important one. The eGFR is very important for this medication. Now, what happened is, and the reason why this is so important is because of a recent patient fatality with respiratory failure. So a patient had this medication, and we're going back. This was updated in April this year. So a patient was on this medication for UTI for 10 days, and the patient died. Okay, I think the patient died. That's what it was. I think the patient died. I think that's what it was. And the reason is because when they were on this medication for 10 days, they developed very, very serious respiratory failure. Literally, the lungs shut down. So because of this, that's why we have a reminder about this update, about us giving this information out to patients, especially in the first weeks or the first days of taking this medication. There's specific advice we have to give to the patient. If not, we could experience something like this again, which we don't want, by the way. So what should we do? What should you do? First thing you need to do is we need to check the patient's pulmonary reactions in the first week. How do you do that? Simply by making that phone call to the patient, or just giving that patient some advice as soon as they collect the medication from the pharmacy. You have to monitor the respiratory. So how do you do that in patient-friendly language? You just have to tell that patient in the first days, if you experience any sort of fever, any sort of chills, any cough, chest pain, any of this struggling to breathe, shortness of breath, if you experience any of these in the first days, you need to stop this medication straight to the doctor. It's so important you give them this information, and that's why this has been highlighted. Right? So if you dispense this medication without talking about this, then you are putting that patient at risk. That's for your pulmonary. And then for your hepatic, you need to also give them the advice about the liver, what to watch out for. So obviously, we cannot tell them hepatic dysfunction. What we're going to say to them, once you start taking this medication, if you notice a change in your skin color or in your eyes, if you notice that it's going yellow, right, any yellowish color, you need to stop this medication. If you have any pain in your abdomen, any swellings in your legs, then you need to stop this medication. Any itching, and then a most common one is dark urine and very pale stool. So if your urine is really dark and the whole jaundice, yellow eyes, yellow skin, if you're noticing any of this or any swellings anywhere, then you need to stop this medication. So combining this as your hepatic advice with your pulmonary shortness of breath, if you did this and you said this to every patient that collected nitrofurantoin, you are working to the up-to-date guidelines. You are providing effective, efficient patient care. And that's really what this session is all about, to help you to give the best service to your patients and to keep them safe. So it is 8 o'clock. I hope you learned something. If you learned something from this, type a yes, type a yes. Next week, Monday, from 7:30 to 8 o'clock, we will be doing a session, but this time we will be looking at some updates in chapter 6 of your BNF, which is your endocrine system. So that's a very big chapter, including all your hormones. So we will be looking at the updates next week, Monday. So thank you all. Thank you all for your time. All of you on the course, on our training program. Our program will be kicking off now at 8. I have loads of questions for you. I have loads of tips for the exam. I have loads of areas that you need to learn that will help you be confident and help you be successful. Take care, everyone. And I look forward to seeing you all soon. Take care. Bye.